Okay, good afternoon, everyone, and welcome to our update for November 19th with regards to COVID-19 in our region. First off, I want to thank each and every one for all the work they've done these last few months to address the issues with COVID-19 in our community. It has not been easy. We are certainly have dealt with a lot, and I know everyone has gone through a lot to this point. I specifically want to thank the business owners who've had to unfortunately put sometimes their dreams on hold, and other ones have lost their dreams as a result of lost businesses. This has not been a good time. 2020 will go down as one of those years that when we look back on it, we'll all talk about how we got through it, and unfortunately some of us did not get through it. But I really want to thank you all for the good work you've done, but I do want to put that out there as a sort of a proviso, because the second wave is here, and it's here with a vengeance. I'm very fearful about what we're going to see in the next few weeks. The statistics have been very discouraging, and they continue to get discouraging and worse. I'm very pleased to be joined by Karen Gambino from Deaf Access Services, and you'll also hear from Dr. Gail Burstein. We're going to provide you just the basic facts and some other information today, and then open it up to questions to members of the media. But as I said, the second wave is here, and it's here with a vengeance. And I am very fearful of what the next few weeks will bring. This could be a very dark time for our community. We have new data with regards to cases as a result of the tests from yesterday. There are now 19,785 total positive cases through yesterday. There were 651 new cases based on the testing from yesterday out of 8,339 case reports. These are new cases. These are not duplicates. These are not individuals who previously tested positive and were determining if they were negative. So 651 new cases out of 8,339, which was a daily positivity report of 7.8% for the county. We now can confirm that 762 people have died as of 3 p.m. yesterday. There were 746 deaths as of November 15th, and there were only 728 deaths as of November 4th. So we are seeing, unfortunately, the growth in deaths, just like we've seen the growth in hospitalizations. And I want to offer my deepest condolences to the loved ones and family members of those who've died as a result of COVID-19, whether it was back in March or the most recent ones, even today. There were deaths that we're starting to learn about. And it's very discouraging, but we know this is why we're taking the actions that we're doing to prevent further deaths and long-term effects that individuals can have from COVID-19. We saw a rapid uptick in hospitalizations in the last few days, especially on November 17th. There were 220 individuals admitted to Western New York hospitals for COVID-19, or COVID-19 patients. 179 of them were in Erie County. It was 185 and 150 respectively on the day before. So on November 16th, there were 185 COVID-19 patients in Western New York hospitals. That went up to 220 the next day. And there were 150 in Erie County hospitals, and that went up 179 the next day. So it roughly went up 30 cases, which is about 20% of 150. So this is a very, very significant increase. And as you'll see, we're not that far away from our highs back in April. On November 17th, there were 35 patients that were in the ICU, and 13 of them had an airway assist. And you do not want an airway assist. That is not good. And that means those people are in significant distress. Here is once again the new case report for November 18th. 651 positive cases were determined yesterday. That's a daily positivity rate of 7.8%. The 7-day positivity average is now up to 7. I just want to remind everybody, just as recent as October 24th, the week ending October 24th, the total cases for the entire week, when we were doing tens of thousands of tests a week, were 401. And here, yesterday, is a new recorded high for Erie County, where all cases were 651. These are new case reports. These are individuals who did not have a prior positive. These are not duplicates, and these are Erie County residents. These are not people who may have been tested in our county who just happen to live in Niagara County. So this is very, very concerning and sad. And here's the hospitalization report for Erie County for November 17th. You see the big uptick in the shooting up with new cases. We are seeing an increase in ICUs. Thankfully, we have not seen ICUs follow the increase as we had in the others. That's a good sign because we know hospitals are doing a better job of being able to manage the cases so that people are not in the ICU as long, or they're only in the hospital for a few days. The other thing that's very concerning is 46% of all patients were 64 and under out of the 179 for Erie County that day. So this just goes to show that it's not just elderly people. We know there are people from every age group. This is what the hospitalization case data with regards to age ranges looked like on November 10th. There were 84 patients in Erie County hospitals on November 10th. And here we are with regards to November 17th. It has more than doubled in an 8-day period from 84 to 179, and you can see the rapid growth in many of the age categories, with the 55 to 64 age category actually making up the largest percentage of cases. And if you'll notice, the axis on the vertical side of the graph had to be increased because previously it was just keeping track of up to 30 cases, and now we have it up to 50 cases in just 1 week on the axis of the graph. That just goes to show that there was such a rapid increase, we had to change the design of the graph. COVID hospitalizations in Western New York from March 20th to the present, and you can see way on the right is the 220 cases for Western New York, and you can make a comparison all the way to the beginning of this in March and April, and the highest case count we ever had was 263. We're not that far away from it, and I'm very, very worried about where we'll be in the next few days. I hope we don't surpass the earlier case counts, but at the current rate of infection, the current rate of hospitalization, I fear we will. And if you look at the graph on the right side with the most recent times, and you kind of compare it to the graph on the left side, back in March and April, we're seeing the rapid increase of hospitalizations like we did back in March and April. Diagnostic test criteria. We, of course, are testing any individual who is sick, has the symptoms of COVID-19, or is a direct close contact of somebody who tested positive. You can call 858-2929 to schedule. It is free. There are many other locations across Erie County and, truthfully, Western New York where you can get tested. We want people to remember that you should be tested if you're sick. If you are sick, do not go to work. Do not go to school. If you've got tested and you're waiting for results to come back, do not go to work. Do not go to school. Your results may come back positive, and in the interim, you may actually have infected other people. So you can get tested through Erie County, and there are, of course, other locations where you can get tested across Erie County as a geographic region and Western New York as a region. But if you are showing the symptoms of COVID-19, if you are a close contact of someone who tested positive, even if you're not showing any symptoms, you will and can be tested by Erie County. And we did confirm that the test results are coming back from basically 36 hours at the most from when an individual was tested. So it's not from the county 6 or 7 days later you'll get the results. You get the results basically the next day. I do want to talk about a couple positive things that we're working on, even as we have issues associated with the cluster zones, but first we'll go into the cluster zones. We know about the cluster zones. We talked about them yesterday. The communities that are in the orange, the communities that are in the yellow. Most of Erie County is in the orange, which has a strong impact overall on what can be done in those communities. The yellow is for the more exterior portions of the county. We want to avoid the red. I don't have the information up here on red because we're not in the red. We want to avoid the red. All non-essential businesses would have to close. And there's a lot of things that are technically still non-essential that are open today, like bowling alleys. You can go bowling with your family. They have to follow prescriptions with regards to the amount of people on a lane and so forth. You can't have more than 10 per gathering. If you were going to have a birthday party with 25 people at a bowling alley, you can't do that. But you can at least bring your family to go bowling if you got 4 or 5 of you and you don't know what to do. So there's certain things that you can do now that you couldn't do if we go in the red. Bowling alleys, all those non-essential businesses would have to close. The rules we talked about yesterday with the orange and yellow zones, and how it applies to various forms of business. And then I'll go into this next slide here because it talks a little bit more about non-essential businesses that have to reduce in-person workforce. People are asking, why were these targeted? Why are you targeting these businesses? It's unfair to these businesses. And I'm just going to say these businesses and industries were the focus of the orange zone because of information that was gleaned by New York State and other states previously. They know earlier that there was transmission from gyms, fitness centers, barbers, hair salons, tattoo, piercing parlors, and the like, because people are in very close contact with each other for a time. As you know, you get a haircut, somebody's working on your hair. A tattoo artist is working on you, they're touching your body. While even though you try to make it as safe as possible, there was evidence that there was transmission at these locations. And so the ones that are listed on the screen are those that have to close effective tomorrow while they're in the orange zone. In the red zone, everything closes except essential businesses. And we're trying to avoid that at all costs. And the only way we're going to avoid that is if we're able to reduce the infection rate, the positivity rate, I should say, the rate of infection in the community, keeping the transmission level down, and keeping our hospitalizations down. We don't want to go red. That's not good. And so we're doing our best to ensure that we're protecting the greater community in full. And there's other things that the orange zone has an impact on. Of course, our restaurants and taverns, today's the last day for indoor dining that can do exterior dining and takeout and delivery. There are requirements with regards to schools and testing, very strict requirements in the orange zone to have in-person testing. Basically, you have to test everyone. First, you have to shut down for a few days. You have to test everyone. And then there's weekly requirements. In the yellow zone, it's not as stringent, but it's still not easy. If you go virtual, you don't need to test everyone, of course. We're thinking it's very important that we just protect our community. I do know from our Department of Health there has been some in-school transmission rate lately with regards to student-to-student or student-to-teacher or teacher-to-student transmission. We're starting to see those cases, and that's what scares us because we know that that's how you further spread it in the community. Some good news, back to business. We are focusing and trying to help our business community. I know there's a lot of critique out there. Oh, you're trying to kill our business community. Nobody wants to kill the business community. We want to keep people working. We want to keep our businesses as strong as possible. But this is not a question of an either or. This is a question about protecting the community so that we can be as strong a community and have as strong an economic environment as possible. This is not an either or. This is about public health and protecting the general community so that we can have a strong business community, so that business owners can thrive. Of course, Erie County has instituted the Shop 716 e-gift card. You can buy one for $25 or more, and you'll get a bonus $25 e-gift card from Erie County. It is, you can do it online. You don't have to go in and buy it at any one location. We want you to do it online. We're working with our partners, the Amherst Chamber of Commerce, on this program. I bought my e-gift card. There's lots of locations across Erie County that you can use it. Many of them you can purchase your goods online using the e-gift card. So we want you to support our local businesses that holiday season by purchasing a Shop 716 e-gift card. You go to amherst.org, Shop 716, to purchase your gift card. And you can also go to that same link if you're a merchant and you want to be part of the merchant process. It's an opportunity for our local community to buy local, and we want people to do that. So for the $25 or more that you buy in a gift card, Erie County will throw another $25, which is going to go back into our community through our local businesses through the Shop 716 program. And I do want to thank our partners at the Amherst Chamber of Commerce for working with us on this great program. I bought my e-gift card. I got to go shop somewhere now. It's important to use it by the end of the year, but we want people to spend their money locally, and you can do it online as well. I'm going to turn it over to Dr. Burstein now to talk a little bit about some of the health and mental health issues that we're dealing with, but I just want everyone to understand that this is a very, very serious situation. I know you've heard me say that recently, but the numbers don't lie. We're getting worse with regards to the hospitalizations in this region. We're getting worse with regards to testing in this region, with regards to our positivity rates. And if we're to get through this, we have to do it together. We have to understand that we're all in the same boat. There's some holes in the boat, and we got to patch them so that we can continue in our communal ship moving forward. And if we work together, I believe we can reduce the numbers so that we can get through this as best as possible. So I'll turn it over to Dr. Burstein right now.
Thank you. So, as well as physical effects that COVID-19 presents, it also brings upon us some pretty stressful mental health effects. I mean, we're all really scared, and this is this virus. We don't feel like we don't have control of it. The number of cases are growing in our community. We don't know who's infected. Many people can be asymptomatic, and it's really scary. And then also there's there was all these rumors, and people are self-isolating in quarantine, so they're all by themselves and they don't have contact with other people like coworkers or families and friends like they used to. So this is a really stressful time. So we just want to remind Erie County residents to really take care of not only your physical health, but also your mental health. So just some suggestions are, first of all, a big source of stress are false rumors anyway, and I think a lot now are being generated on social media. So really try to limit your time on social media. A lot of this are nasty rumors and exaggerations that just will give you a lot of stress because they're not true. And also you want to make sure that you get all your information from reliable sources. So remember, check your source. So the Centers for Disease Control and Prevention, the Erie County Department of Health, the New York State Department of Health, a lot of the medical societies like the American Academy of Pediatrics, they all have good, valid information. So just because somebody posts something on a blog doesn't mean it's true. We have to stick to the facts and act appropriately. So knowledge is power. Also, it's really healthy to spend time outside. It not only helps your physical health by giving you some exercise, taking a walk, it really helps your mental health. The exercise boosts your endorphins and it'll give you kind of a natural high in your mood. Also, when people are really stressed, you might want to try to practice relaxation techniques like deep breathing or meditation or yoga. And if you're not familiar with any of that, there are a lot of great free videos to learn how to do that yourself at home. Also, pick up some hobbies that we've had to put behind recently. So, pick up some books that you haven't read for a while, or listening to music some album that you haven't listened to in a long time. Also, talking to people that you love and you trust can be very comforting. Just sharing with them, your fears and your hopes. But remember, if somebody you trust and that you feel comfortable, sharing what the truth is and what your feelings are. And also, if your parents, talk to your children. It is so important to understand, what your children are hearing, what they're thinking, what their concerns are. I'm sure they're really scared too. They see you scared. They hear all this bad news on the media and on social media. So it's really important to talk to them, listen to what their fears are, and then correct any misunderstanding or misinformation they have, and help them get a plan for them, make them feel more comfortable with their current surroundings. So I just want to reinforce again, Erie County residents, please stay at home. Stay at home for the holidays. We don't want you to cancel your Thanksgiving. Thanksgiving is a great holiday, and it's important to share it with the people around you that you love. But this year, we really are begging you to share it with the people around you who you live with. So, you don't have to, eat indoors with a lot of different people. It can just be, a small gathering, and, CDC recommends this. Also, you don't want to bring in people to dinner or join people for dinner that at higher risk of becoming very ill with COVID-19, like maybe your parents or your grandparents or, people with other healthcare conditions. So it's just safer and simpler just to keep it small, keep it safe, and just keep it at home. Just stay at home for the Thanksgiving. And then you can enjoy the holiday virtually with your family by tuning them in with Zoom or WebEx or some type of YouTube or some type of other social media where you're able to join other people and see them virtually. So I just want to point as an example of just some. I know that people have been considering. I'll go over my friend's house or my parents' house, and I'll get a test first, and I'll make sure that I'm negative, and then I'll go to their house because then they'll know that we'll all be safe because I am negative. And remember, a diagnostic test, it just tells you what your status is at that point of time when you get your specimen collected. So all it does is it tells you, if you have a negative test, that at the point of time when you had your specimen collected, whether it be a nose swab or an oral swab or whatever type of specimen, saliva, at that point in time, the test could not detect virus. It doesn't mean you weren't infected, and it doesn't mean you won't get infected right after the test. So say, today is November 19th, and you're planning on joining a family out of town or who live out of your house for Thanksgiving dinner. So that's a week from now. So today, November 19th, and we're going to use the example of Casey. Casey wants to join her family for Thanksgiving. She doesn't live with them. So she goes and she plans to get a test. However, today she goes out shopping and she gets exposed to COVID-19 and she gets infected. And then fast forward 4 days later, she feels well. It's right before Thanksgiving, 3 days before Thanksgiving, I'm going to go get a test. So on November 23rd, Casey goes to get a test, and it's negative. So Casey thinks like, oh, I'm good, I'm not infected. So on Thanksgiving, November 26th, with a negative test, although her infection is incubating and she feels well, she has big Thanksgiving holiday with 17 of her friends and family and exposes all of them. Then 2 days later, Casey starts to feel ill, so she gets another test and she turns positive. So all those 17 people that had Thanksgiving dinner with her were exposed to COVID-19. They're likely infected because we know this is very, very contagious, and they'll have to suffer whatever fate that is. So remember, testing gives you a limited amount of information. We can't test our way into the turkey. We can't test our way out of it. So remember, stay at home with the people that you live with all the time, and don't expose other people, because you feel well now. You're going out, you're going shopping, you're doing other things. You don't know if you could be exposed and when you were exposed, and you don't know that even though you feel well now, if you could be infected. So please remember that, and keep the Thanksgiving dinner small, and keep it at home. So with that, I'll turn it over to the county executive to answer questions.
Thank you, Dr. Burstein. If there's one advantage of doing a Zoom Thanksgiving with your family, is that if they start talking politics, you can just click off. Because the last thing I think everyone wants to deal with after this year is the political talk, including with family members who may not agree with your choice for president recently. As we noted, it's probably the only thing I can think of positive about what's going on right now. This is a very, very sad time in our community. We have lost more people as a result of COVID-19. We all offer our deepest condolences to those who've lost loved ones. We certainly offer our best wishes to those who are in hospital right now, trying to recover from bouts of COVID-19. I know that there's individuals that probably thought just last week that this is okay, I can get through it if I get it, and now they're sitting in the hospital wondering if they're going to survive. So to those individuals, we just want to offer our best wishes for a quick recovery and a symptom-free after recovery, because we know that there are some individuals who've been suffering some of the after effects of COVID-19 even months after their initial case. It is very, very serious. It's going to continue for some time. If we can stem the tide, we can avoid the red zone that will basically call for the shutting down of all non-essential businesses, and we will save lives. And that's what this is about. It's about saving lives until we can start distributing a vaccine to the general public, which in all likelihood won't be at least till the earliest of February or March next year. It's great to hear about the advances in the Pfizer and Moderna tests, and we know that some of the other drug companies will be announcing the results of their tests soon. But even if they did mass production starting today, we know it will not get out to the general public for the next few months, and that's why we must do all that we can over the next few months to save as many lives. With that, I will open up the phone lines to our friends in the media, and I do want to thank Karen Gambino for being here today as our Deaf Access Services, our language interpreter. We will start today from the bottom. of my list here. So we'll start with WBEN, Brendan Keeney. Brendan, just if you remember, you have to hit *6 to unmute yourself.
Hey, Mark. Can you talk about hospitals and the conversations you've had with some of the leaders of our hospital systems here in Erie County? Obviously, a huge spike, and I just want to see where we stand as far as concern.
Well, I do know as of the 17th, there were less than 30% of all beds available combined in the hospitals, but we still had a pretty good amount of ICU beds. I'm actually having a conference call with the hospital officials very soon. I do feel comfortable with their PPE. They were required to have at least 90 days worth of PPE on hand, which was very important as we saw the shortage of PPE, but we are worried about shortages of beds. I do know that some of the hospitals are starting to stop visitation. They're starting to slow down on elective surgeries so that they have beds available for COVID-19 patients. Thankfully, the ICUs are not getting as inundated as they were earlier, but if we continue to see this rate of growth, we do know that a certain percentage of those who are testing positive will get sick. And the death rate is approximately 1%. So if we had 651 positive cases yesterday and 1% of them die, that's 6.5 people. So we're very worried about where this is going in the near future. But I do know that the hospitals have sufficient PPE on hand. The county has its stockpile as necessary for hospitals and our emergency workers and the health department. And I will be having a call with the CEOs very soon to get more information on the specifics they're seeing. But I have seen the reports from the hospitals. I believe it's 27% of open capacity, so to speak, vacancy in beds, which means that over 70% of the local hospital beds in Erie County are actually being occupied as we speak. So the hospitals have plans to put in place, and I'm going to find out more about what their intentions are for the near future. WBFO, Michael Mroziak.
Good afternoon, Mr. Poloncarz. Sheriffs across the state have already expressed that they have no intent of enforcing the state-imposed rule, no more than 10 people at a gathering. Between that and some of the other defiance we're hearing in the public, are you concerned that most folks are going to thumb their nose at the rule and have the Thanksgiving gatherings that will perhaps cause trouble down the road?
Well, good afternoon, Michael, and I am very worried about that. I am aware of an individual who died recently who was a anti-masker, didn't really think that this was real. What I'd ask for are those families, if your loved one passed and they didn't believe that this was true, we ask that you tell your story to the public. Tell your story to media so that other people will understand that it is true. I am very worried about people just saying, I'm going to do whatever I want to do, because what they're doing is not only putting themselves at risk, but they're putting other people at risk. To our partners in local government, I certainly hope that they are not voicing opinions that are inaccurate and putting people at risk, and unfortunately I do believe there are some that are, to the point where they're denigrating our actions with regards to how we're responding to the COVID-19 outbreak. We have a global pandemic. It's affecting the whole world, and it seems to be affecting the United States worse than most other countries. Maybe it's because people think they can do whatever they want, but we are all in this together. As I said, we're in our communal ship, and it's got some holes in it right now. And we don't want to go down like the Titanic. We want everyone to work together so that we can keep that ship steady and moving forward with everybody in it, with everybody on it. And I know we're going to lose some more people over the upcoming period, but if we all do the right thing, we can protect people. We were posting on social media, I was posting on social media about mask wearing and how important it is because you may save a life. And the life you save might be your own, might be your mother's, might be your child's. Think about it. Is it worth it to snub your nose to what we're doing, just say, I'm going to do what I want. I'm going to ignore everything and I'm going to do what I want, when you're potentially putting yourself and your family and other people at risk. And once again, I ask those who may have lost a loved one recently, especially those who the loved one thought this was a hoax, didn't believe in mask wearing, please come forward. I can't reveal your story, but I know some of those stories exist. Please reveal your story so that other people can learn from, unfortunately, your loss. Buffalo News, Sandra Tan, Aaron Bessiker.
Hi, Mark. Obviously, effective contact tracing is more important than ever. I actually have a question for the health commissioner.
Sure.
We understand that the turnaround time for getting positive results from the county is still relatively rapid, but the concern seems to be when people who are positive are getting notified of a positive result. Because from what we're hearing, if you are negative, you're finding out right away. If you're positive and waiting for a contact tracer to get back in touch with you, and because you directly made an appointment to get tested with the health department, you're waiting 7 days or longer to hear back from a contact tracer because
That
of
is
the
not,
shortage.
that is not correct, but I'll bring Dr. Burstein up to and answer that.
Okay.
Thank you. Hey, Sandy. So,
Hey.
first of all, Erie County Public Health Laboratory does a minority of the COVID-19 testing in our community. So most of the testing is done by other labs. I think we do about 450 to 500 polymerase chain reaction tests in our public health lab, and now we're doing about 800 rapid tests, and those are both per week. So as you see, we're getting over 25,000 tests per week done, and so we have a very small footprint in that. So the labs can take from outside Erie County Health Department can take varying amounts of time to return, and so and also we've heard that what we find is people are calling us in the community asking for their test results, and because they think that they were tested by our public health lab, but they weren't. They may have been tested by the state lab or another lab. So with our results, they should be available in 72 hours. The ones that we run, and we're notifying the positives and the negatives. A challenge that we have, first of all, is number one, many people, as I'm included, if I see a number on my cell phone that I don't recognize, I don't pick it up. So we're hearing from the contact tracers and the people calling for the reporting lab results that it's not uncommon for people not to answer the phone. And we don't have a portal to provide secure results, so we have to rely on talking on the phone or a fax. So communication has been a bit of a challenge. Also we have you seen that we've had an abundance of positive tests of new COVID-19 cases in the past couple weeks. That's really been overwhelming for our contact tracers. So we've really stepped up, and we've really stepped up the number of contact tracers, and in making sure gone through viewed training, making sure they're most efficient. So today we have 62 contact tracers. We are hiring 7 more that will start next week, Monday. And we're documenting the number of cases that they contact. So the average contact tracer is able to reach out to about 10 cases. Again, not everybody answers the phone. They usually are able to be successful in contacting about 8 cases a day to discuss their test results, to test isolation, and then also ask who their close contacts are, so that another contact tracer will contact those close contacts outside the household and make sure that they're in quarantine. So we realize we have been overwhelmed recently with number of new cases, and we have responded, and we have more contact tracers. We're hiring more, we're training more, and hopefully we can slim down that backlog that we have.
So are you telling me that if someone gets tested by the county, that they are, as soon as their results are determined, that they're getting told within 1 to 2 days or 3 days or 4 days? Because that's not what we're hearing.
That's my understanding is, again, we're not always successful in reaching out to the people that had tested with us. Not everybody's answering the phone, and unlike other labs and other healthcare facilities that have a patient portal, and so people can get online and access their own test results, we don't have that capability in the county, so we have to rely on giving results over the phone or faxing because of confidentiality.
Okay.
Thanks.
Thank you. Andy Young from Spectrum.
Hi, Mark. Wondering if you might expand on the point you brought up about schools and seeing an increase in transmission there. For a long time, many people have operated under the assumption that schools were relatively safe and transmission wasn't as apparent there. What sort of evidence are you seeing, and if you could expand on that?
Well, I'll start and I'll turn it back over to the doctor. We are actually seeing our contact tracers identifying individuals who they believe may have contracted it in school settings. We're dealing with many more positive cases where individuals are being put in quarantine because they were exposed as a result of an exposure in school and then within the 14-day quarantine period turning positive. It's very difficult to 100% guarantee that is where they caught the infection, but we're seeing more of those cases. So I'll turn it over to Dr. Burstein to answer a little more.
Thank you. So, we don't discuss any individual cases because of patient confidentiality. However, we have identified, not many, but we have identified a few cases where we believe transmission occurred in the school. And so in general, the school is a safe place, and we have in the Erie County Health Department a very conservative protocol where if one case is identified in a classroom and the classroom is meeting for over 60 minutes, then everybody in that classroom with a positive case, regardless of where they were sitting or if they were wearing masks, is put in quarantine for 14 days. So that's been pretty effective at keeping people healthy in the schools and preventing COVID transmission in the schools. However, we have seen a few cases where we believe transmission has occurred in the schools. However, in general, we believe that our protocol, being very conservative about placing people in quarantine in a classroom that has met for over 60 minutes, has been effective. And I think parents who are able to send their kids to in-person learning, if they decide to do that, they should consider it safe. However, right now in the yellow and orange zones, I know many schools are going virtually, and that was a plan that they have in place, and we know that eventually we'll be able to get to in-person, but anyway, the schools have had some in-person transmission, not a lot.
Okay, Kelly Dudzik from WGRZ.
Hi, how concerned are you guys about people going into the yellow zones or out of our county to go to the gym or get their hair done? And how could that contribute to the spread? Because there are a lot of people who are saying that that's what they're going to do since they won't be able to do it here.
Well, I would note that some of the areas in Erie County that are in the yellow zone have the highest positivity rates over the last week or so. So you're putting yourself at risk and potentially transmitting it to other places as well. I would just recommend to folks that try to stay in your own lane, so to speak, from a standpoint of you might not know what you're driving into. I do know that some of the highest rates for the last few days and the end of last week, positivity rates based on municipalities were in Elma, North Collins, town of Boston. I was on a conference call last night with supervisors and mayors and was reading their numbers, and they weren't really shocked because they know of people in their community who are sick. So if you drive out because you think, well, I want to do indoor dining, so I'm going to drive out to that restaurant I like in Boston, and you're coming from Tonawanda, you may be sick and not know it. You may be infected and not know it. You can infect people down there. You could be next to someone who's infected down there and not realize it. We just tell people that these restrictions are being put in to save lives. No one wants to shut down the economy. Nobody's interested in doing that. We want to save lives. And if you think, hey, I'm going to go to my cousin's house in Rochester for Thanksgiving, and we're going to have a big family gathering. I mean, that could be a death knell for members of your family, because you never know where some of these people have been. You don't know if they're infected. And as the doctor noted earlier, depending on your test will give you the results if they can identify the virus in you at that moment. It may be in there, but it may not be at a level that's detectable because it's just incubating. So you could get a test and show that you're negative and think, oh, I'm fine, and then go out and get other people sick. So we just want people to understand that the restrictions are in place because of rapid increase in testing, or I should say the results of testing with regards to positivity rates, the rapid increase in hospitalizations, and the growing deaths. And I'd hate to find out a story about someone who said, I'm going to drive 45 minutes away so I could go to that one salon or I could go to that restaurant, and then find out like the next week they're sick and they're hospitalized or somebody got sick as a result of that. That's a terrible thing you have to live with for the rest of your life. Chris Orvadas, Channel 4.
Hey, Mark, I'm going to ask you to do some quick math here, so I'll give you the benefit of the doubt. Based on the trend in hospitalizations right now, how soon do you think until we reach full capacity, and if it continues at this rate, of course? And I'm wondering if you're dusting off the old plans to turn the convention center into put some hospital beds in there.
We've had discussions with regards to the convention center conversion. Nothing serious at this point, but we actually have those old plans in place if we need them. It's kind of tough to say when hospitals would reach peak maximum because they are also allowing some elective surgeries and other things to be going on in the hospitals now that if they stop those would give us more hospitalization beds. They also increased their bed capacity earlier when they needed to. They decreased it back to their normal level. I think they're in the process of increasing it again. So I can't give you an exact date, but all you got to do is look at the chart I have on the screen, the graph, and you'll see the rapid increase in Western New York. And thankfully we have not seen the huge increase in ICUs, but the ICU numbers are going up. And at this rapid increase, with the number of individuals who are testing positive now, we believe we will surpass that 263 is the high. Because when we had all those people going to the hospital earlier, we did not have infection positivity rates among the general public at such a high rate. We had less testing, but we do not believe that we had as many individuals being infected by the virus back then. Why? Because we did a mass shutdown. And so pretty much the whole community shut down. So we are very worried that within a week from now, considering we've been doubling hospitalizations over the last couple of weeks, we not only will surpass the 263, but we could be much higher. And then we're looking at alternatives, including if we had to, turning the convention center into a COVID-19 only hospital. I hope that doesn't happen, because if it is, then it's really bad. Ashley Rowe, Channel 7, WKBW.
Hi, County Executive. Beyond Thanksgiving, we've got Black Friday shopping, and then we've got, the holiday season where people are going to be in a lot of the big box stores, in a lot of the malls. What kind of public resources are you willing to put forward to make sure that these big box stores and these major retailers where we know people are going to be waiting in long lines, et cetera, are safe and that the rules are being enforced?
We will have our health department inspectors, and I know the state will as well, and we are not adverse to shutting down a retailer, not allowing them to open up their doors because there's hundreds of people waiting in line. I don't care. I would rather shut down their doors and cost some national retailer the thousands of dollars in profits they would have met that day than have hundreds and hundreds or thousands of people potentially get infected because they went crazy at a Walmart or a Target or a Best Buy. I mean, we have the ability to do that. If they're violating their capacity requirements, if they are not providing a safe areas where people have to be 6 feet apart, we can shut them down. And the warning's out there. And people need to understand that this year is going to be different than prior years. We will have our folks out there. And I don't really care if I get a call from a lawyer out of Los Angeles for one of these national companies saying, you can't do that. Under the laws of the state of New York and Erie County, in the emergency situation we are in now, we can. And I would hope that people would understand that as they go about their business, because is it really worth saving an extra $25 on that big screen TV to potentially catch COVID and die? Of course not.
Quick follow-up question to that, Mark. Just to the business owners who have gone to extreme lengths, gym owners, salons that have gone to extreme lengths to make everything safe, put the plexiglass up, et cetera, they're being forced to shut down, and yet you've got people who are going to be waiting in line to go shopping and do their Black Friday shopping at these big box stores. What do you say to them? How do you make sense of that?
Well, what we have is a situation where the state, along with the CDC, determined what were the most at-risk areas. And they talked about these personal care services where the individuals are doing work on the individual, or they're in a different environment. There's working out and there's a lot of heavy breathing and things like that. I certainly understand the feelings of these business owners. I fully understand it. That's why we're going to be out there to enforce it. And with regards to the big box stores, if they follow the rules, they'll be fine. If they don't, they'll get shut down. And that's just how it'll be. And we want to avoid the red, because you know what's going to happen? If we went in the red, none of those big box stores are going to have Black Friday. If the numbers were so bad that next week New York State determined on Wednesday that we're going in the red, you know what happens to the big box stores? They cannot open to in-person service. They can only do curbside pickup. Same thing with every other non-essential business will be shut down. And if people want to go about there and say, hey, I'm going to act like normal years, and we're shutting down our community for weeks at a time as a result of that, I feel bad. I feel bad for so many people who will be out of work and the impact it'll have. Not worth it. As I say, it's not worth saving $25 or even $250 on that big screen television and then finding out 5 days later you're really sick with COVID and you probably passed it on to someone else when you were out shopping. We'll do one more round of questions, quick lightning round, so to speak. WBN, Brendan Kearney, do you have any more questions?
Yeah, Mark, is there going to be a shift in mask messaging to even extend to private residents?
We recommend that you wear a mask even if you're in your private residence. If somebody that is not in your household is there with you, we're not telling people to wear masks 24 hours of the day at their home with their loved ones, their spouse, their children. But if you have people coming over that have not been in your house, that you've not been around, you should wear a mask. It's as simple as that. Michael Mroziak, WBFO, any other questions?
Yeah, one more question. Earlier in the pandemic, the public was encouraged to take advantage of the parks, get outside, practice distancing, of course. In light of the rising numbers, is that still encouraged?
Well, it's encouraged to a point of view where you're not coming in contact with other people you haven't been around. As a result, we have canceled the remainder of our ranger walk programs that we normally have on the weekends, because we usually have 25 to 30 people with the ranger, and we can't do that because of limitation for gatherings of no more than 10. So if somebody goes for a walk in the park, I think that's fine as long as you're not congregating with other people and you're doing it in such a way that you're putting yourself and other people at risk. If you are going to go for a walk in the park, I'd recommend wearing a mask, even if you're just with your family member, because you're going to be passing by other people. I do the same, even though I take my mask off for a while, but then see somebody coming up, put the mask on. Just best for all. Buffalo News, any more questions?
Yes. Go ahead, Aaron.
Can I throw in one? In terms of the timetable going forward, I know we don't want to talk about a red zone, but how soon what's your understanding how soon that could happen? I mean, you just referenced possibly by Black Friday.
Well,
but is that
Aaron, what we're seeing is the state will be analyzing the data starting Monday evening and Tuesday, and they'll be making an announcement one way or another on Wednesday, just like we saw this last week. We want a full week's worth of data since the announcement. It's not really a full week, but it's pretty close, so we can see, okay, are there changes? I mean, we're not happy about the most recent ones, which are showing the positivity rate going higher and the hospitalization rates going higher. But I would not anticipate any announcement from the state until Wednesday, after we've had another full week's data, so we can do a comparison from the end of Monday of last week to, or I should say this week to Monday of this week to Monday of next week. Okay, what are we seeing? And then the analysis will really be done on Tuesday with an announcement on Wednesday. Not to say that it's going to go red on Wednesday, but if there's going to be changes, it's going to be announced by the governor or the state on Wednesdays. Spectrum News, Andy Young.
We've received a lot of questions from folks asking about the effect of nursing homes and large outbreaks in nursing homes and the effect it has on the data and the uptick in both hospitalizations and overall numbers. What can you say to that effect, and are you seeing that rise again?
Well, first off, I'll just note the number of hospitalizations. With regards to the 46% of all people who are hospitalized on November 17th were under 64 and under, and the largest age group was 55 to 64. We do know that there are cases in nursing homes. There is not a massive outbreak that's driving our numbers. It's just general community spread. So people who are like, oh, it's those nursing homes, they're the ones that are driving all these positivity cases. That is not the case. It makes up a small percentage of overall cases, because we will get the updated data. And what we're seeing is, yeah, there's a case here, there's a case there, but it's not like, oh my Lord, we're getting 50 cases from this one nursing home in one day. That's not the case. And that should scare the heck out of everybody, because it's saying that it's general community spread. And as we talk about in this chart here I have on the screen, not only have we seen a doubling in hospitalizations, where on November 10th, you saw that the largest age group, once again, as a category for the number of people hospitalized, was 55 to 64, but that has more than doubled, and it is growing at even a higher rate than the other age categories. So that really is kind of scary, that the people who are being hospitalized are in their middle years, so to speak. I'm glad to see we're having less with regards to the real young, 0 to 19. There was no one at this most recent one. But all age categories otherwise are growing, and the largest growth right now appears to be in the age category associated with 55 to 64-year-olds. And those are not generally people in nursing homes. Kelly Dudzik?
Yeah, are there any more plans to help any of the small businesses that are going to be impacted? I know that there was just a round of grants available, so what can business owners do?
The grants have not been released. They're finalizing the review process right now. 43 North is working with Erie County, and 43 North is actually doing the analysis. I do expect to hear, hopefully in the next week, the first round of grant recipients. So the individuals who applied will find out, first off, if they've received their grant, or for whatever reason if they didn't. So that will be coming soon. We have $20 million available, and hopefully soon enough we'll be releasing funds to many of the members of the business community who applied for them. WIVB, Channel 4. Chris, you have any more questions?
Yeah, kind of going back to Ashley's question a few minutes ago, the county and the state provide a lot of testing data, but there just isn't a whole lot of tracing data that's provided to the public. So I think some of these fitness, some of these gym owners, some of these barbershop owners, for instance, they have a hard time because they can't look at the data and see proof that that there's indeed true risk of spread in their facilities. So what can you say to them or what can you show them? What data can you point to, or what can you say to them to convince them of that?
Well, first off, Chris, it's general community spread. It's everywhere. And if we did a press conference where we were announcing every location where somebody was that had COVID-19 and was possibly symptomatic or could infect others, we'd probably be here till tomorrow. And I'm not joking. It's everywhere. People are walking around our community right now, probably going to a gym or a restaurant, that are asymptomatic. And they may have it and not know it, and they could shed that virus. That's why the community spread growth has been so quick lately, is because it is everywhere. So any location that says we've never had anybody walk in here who was COVID-19 positive, you cannot say that, because you probably did. Maybe you got lucky and the person wasn't shedding the virus. But it's bad, and it's everywhere. Final question, I think goes back to Ashley.
I'm all set. Thanks.
All right. First off, thanks everyone for being part of our media update on the 19th of November. Just going to reiterate the latest, the new numbers in case anybody missed it. As of yesterday, or for yesterday, there were 651 new cases that were identified out of 8,339 test reports received. These are new cases. These are not duplicative ones. These are not individuals who previously tested positive and were trying to get a negative test. So there's 651 people who tested positive yesterday who 2 days ago, 3 days ago, would not, or whenever they got tested, didn't know that they were COVID-19 positive. It was a record for the number of cases we've ever had in a positivity in one day. And as I noted, it wasn't that long ago, October 24th, a week's worth of testing, all positive cases were 401. This is an exceptionally serious situation. The second wave of COVID-19 is hitting us with a vengeance. We have to do the best that we can to protect the whole community. I thank everybody for what they've done over these last few months. I know this is not a good situation that nobody wants to deal with. We really would like to be thinking about the holiday season and what we can do with our family to enjoy it. The best thing you can do for your family right now is stay with your immediate family. Don't see other people so that you can protect them, you can protect yourself, and hopefully in the long run, save a life. Because I know of the 651 new cases that were identified yesterday, if the death rate is accurate, around 1%, at least 6 of those people will die. And this is preventable. Be safe, be well, wear your mask until I see you next time. And let's all do this because we're all in it together. Thanks, everyone.